having stage 4 disease does not mean that there's no treatment. It does not mean that you are condemned to staying at home, because there's so many factors we consider. The staging is for us to know what treatment options we're recommending. So it is treatable. It's not as easy, and that's why we are actually recommending for screening, because many of us tunakaa nyumbani na mashida zetu by the time we're presenting to the hospital. And as we started by saying, cancer is replication, which means si ati inakaa inatulia tu hapo hadi ukue ready. It has the capability of spreading.
Saseni mko fiti, manze nimewa miss, manze nimewa hata. Thank you so much for always tuning in. Thank you so much for your engagement. Thank you so much for your comments. Thank you so much for your feedback. Thanks to those even who cut snippets and take them on TikTok. Asanteni sana, sana, sana. Now, of course, this is the last Wednesday before October ends. Na najua labda mnajiuliza, Sele, October, it's Breast Cancer Awareness Month. It's the pink month. It's, I don't know how you call it, but in October, we all talk about, in October, we all want to create more awareness, want to grow it. It's growing, and I'm grateful. Hatuko kwenye tulikuwa some years back. So we want to keep on pressing and pushing until tumefika mahali pa, okay, now everybody knows what breast cancer is. Everybody is, everybody has gone for screening. Everybody has, because whether we like it or not, breast cancer is affecting all of us, either indirectly, directly. Na si women peke, women, men. So it's for our own good to talk about it and to create awareness. Okay? Na sijui kama tukianza issue kama wewe umeenda screening, jijibu tu. Kama wewe umeenda screening, kama unaogopa, it's all right. Yeah, but you mimi si expert. I have a guest who has the authority, who has the knowledge. Because again, kwa hii channel we learn and unlearn. Because wewe labda unafikirianga breast cancer tu ni ya mama, leo utajua si ya mama pekee hadi wa baba, So I have someone with the knowledge, the power, who is able to guide us and educate us more, for us to at least understand. Maybe you are thinking this, we have so many myths around these things. So today on set, we are going to be clarified some of these myths, some of these sayings, some of these, some of these things that we think that we know, yet we don't. So thank you so much to our guest. Siwagombenisha ngivi sana, but sometimes
inabidi
nataka tu to understand,
Yeah.
So before we dive deep into the class, please introduce yourself.
Okay, I'm so happy to be here. First of all, my name is Cheryl Agutu. I'm a doctor working at Texas Cancer Center. And as you said, this is such an important month for us, not because the rest of the months aren't, but because people are taking the time to demystify and make breast cancer awareness something that's more reachable for all of us across the country. So I'm definitely grateful to be here to be a part of that as well.
Thank you so much.
Yeah.
So you've had from an authority level, from a doctor. I'm sure you've interacted with so many patients.
Yeah, for sure.
Like so many breast cancer patients.
Yeah.
Before we even move and assume that all of us know what breast cancer is, can you please, as like a 2-year-old baby, tuambie ni nini hiyo?
Sawa. So I think for cancer, tunapenda kusema cancer sio malaria, because malaria seems more familiar to many of us. But cancer is a disease like many other diseases. The same way we have chronic diseases like hypertension, like shida ya sukari. Cancer is also a chronic disease. And the thing about cancer is just the fact that it's multiplying in the body unlike other conditions, which means that it requires regular follow-up, but it is treatable. Patients with cancer can also get into remission. So cancer is that basically. It's a disease that causes multiple replication of cells in the body, and it can be anywhere in the body. So in this case, we're talking about the breast tissue in particular.
So found at the breast.
Exactly.
And here we thought it's only for the women.
It's not for the women alone. Actually, there also breast cancer can happen in men because we all have breast tissue, men and female alike. It's just that the percentage of breast cancer in men is much lower, but 1% of all breast cancer patients are actually men as well.
Did you know? Now you know. Now you know. Let me ask, we get to hear, I'm sure, tumesikia wengi. Oh, alikuwa stage 3. Oh, alikuwa stage 4. Oh, alikuwa... Can you please elaborate the different stages of cancer?
Okay. So the reason why we actually stage cancer is for us as doctors, because it's a way of communicating, right? Mm-hmm. So if I'm talking to a colleague and I say this is stage 3, and then it's easier to understand. Our guidelines for treatment recommendations is based on the stage. Now, unfortunately, people have also picked on this staging and they have used it as a way of causing condemnation for the treatment. So if someone hears stage 4, the thing that's coming to their head is that this is death, right?
That's what I thought. I thought
exactly.
Stage 4 is big cancer.
Exactly.
Than stage 1.
So the difference between the staging is how advanced the disease is and where it is in the body. So you can find a very small tumor that can be stage 1. You can have the tumor has spread to the lymph nodes, what we call ngae, because we have lymph nodes everywhere. Yeah.
So that is stage 2.
So it depends on a number of things. It depends on the size of the tumor. If there are lymph nodes involved, then stage 4 tends to be if it's gone to other organs in the body. So if you have the cells in the bone, if you have the cells in the liver or the lungs, then that's stage 4. But the thing about the staging is we have made it to seem like if it's stage 4, you don't need treatment because umefika mwisho kabisa. So it's really hard to make people understand that, because watu wanaogopa. Mtu akisikia ni stage 4, done.
So you can go for the screening, then you're at stage 4 and still get
Exactly, everyone. So that's why I was emphasizing that the importance of the staging is for us to be able to know the treatment options.
The doctors.
Exactly.
Not for the patients to feel like I'm far beyond
I'm done.
treatment.
Exactly. So that's one of the myths that now we're demystifying. Having stage 4 disease does not mean that there's no treatment. It does not mean that you're condemned to staying at home, because there's so many factors we consider. The staging is for us to know what treatment options we're recommending.
So when you say a patient has a stage 4, it means like the treatment, it has spread far beyond. So stage 1, the treatment won't be as much as stage 4.
Yes. So we say for stage 1 to 3, since it's localized, then we have role of local treatment. So if we're recommending something like surgical, our goal for treatment in that case is to get to the point of remission or cure. So the thing about stage 4, it just means that it's harder to get to the point of complete cure, but there is treatment for controlling the disease. I
think when you say harder, now we understand.
Yes, exactly.
We feel like, hiyo ni ngumu hata huwezi pona.
Exactly.
Like, that's how we take stage 4.
Exactly. So it is treatable. It's not as easy, and that's why we are actually recommending for screening, because many of us tunakaa nyumbani na mashida zetu by the time we're presenting to the hospital. And as we started by saying, cancer is replication, which means si ati inakaa inatulia tu hapo hadi ukue ready. It has the capability of spreading. So the earlier you come and the earlier we diagnose, and there's higher chances for us to get to remission. So we say for patients who come stage 1, stage 2, you have high chances of getting to 90% survival rates. But if you come in stage 3, stage 4, that's reduced by up to 15%. So we're just looking at better chances and optimal living.
I get it. Yeah. I get it. Now that you've touched on the myths, and I think that's where most of us are.
Yeah.
Mi kwanza hiyo ya, I stage 4. Like, I know it sounds like there's no hope. This is it.
Yeah, for sure.
There's no hope. Stage 4 is now you're.
Yeah.
So I'm happy that you've demystified that.
Yeah, for sure.
It means it's just your language as doctors.
Exactly.
Of course, with what you've mentioned, it has spread further as opposed to stage 1 and 2, but it doesn't mean it's the end.
Exactly.
Yeah. So which is like the other myth, which is very common.
So I've had patients who have been scared of, so in our facility, you have patients who've come for screening. So screening basically means you don't have anything, but you just want to make sure. Then there's when you have something and you don't know what it is, and you've come to like, doctor, tell me what is happening on my breast. So when patients come and they have a lump and the possibility of it being cancer, I had a patient the other day who was in that particular space and she was crying. From the time she walked into the hospital, she was crying and crying. So I was asking her, what is your fear? Like, what's going through your mind? And the two things she said is that we've been told that if you get chemotherapy, you're going to die, because you've seen patients who are undergoing treatment for chemotherapy and wamepata chemo wameenda. Then two, what if I have cancer? Will I have to have my breast removed? How will I live like that? So there are fears like that. Those are some of the real fears. We can't dismiss them, that patients have. So it is a myth, like chemotherapy will kill you, because everyone's journey is very individualized. And that's the thing, because people will compare. I have breast cancer. I saw someone else with breast cancer and they died. That means that that's my fate as well.
So is it true?
So
Because that's what I've heard also.
Yeah.
Like chemo will speeden you, like your journey quicker to, dying.
Yeah.
That's what we've had actually.
It's real. It's very true. Like, that's what people say, but that's not true.
Oh,
yeah.
Okay.
Yeah, because we have many patients, and that's why it might be like, if I'm speaking to you here, it just seems like words because I'm just a doctor.
Yeah.
But when you hear it from a patient, because we have several patients who have been on treatment for breast cancer and they're living 10, 15 years. The other day we had a screening in Machakos and we had testimonials from breast cancer survivors. So if it doesn't count hearing it from me, there's so many other people who are out there giving the same message, and they've gone through chemotherapy. And it's really important for us to demystify that, because chemotherapy, we cannot recommend something that is going to put you down. There are so many other factors in play. There are people who have cancer and they have other conditions. They have pressure, they have HIV, they have diabetes, and maybe because of age, because of their health generally, those are things that make them succumb faster. But it's a holistic treatment, just the same way you take care of yourselves. You're taking medication for pressure, but you're also watching your weight. You're also looking at your diet. It's the same thing.
It's not one way.
Exactly.
Yeah. I love that you've said we've had stories. Personally, I've had stories.
Yeah.
Like, you've seen someone who had breast cancer like 20 years ago.
Yeah, for sure.
Now they are living,
Exactly.
they're okay, So fear is what kills us.
For sure.
Especially like for that client who I'm seeing that client as me.
Yeah.
Because you don't have a lump, you're just going in for screening. But what if?
Yeah.
What if?
It's that.
So I really want to go in and make sure I'm okay for the screening, of course.
Yeah.
But what if I came out of there with some bad news? Or what if I went in there and I'm told we had stage 1? Am I ready?
Yeah.
The what is are the ones which are killing us even before the real thing.
That's true.
Yeah. So you've said those are 2 myths so far. And I feel like we have so many myths, especially in this country of ours.
Yeah.
In Africa, so many myths. Let me ask you one. So once my breast is cut, am I able to give birth, have a baby? Because that's the other fear. So I'm a girl. I still want to have babies, and I want to. Yeah. So now my breast is cut.
That's very valid. And unfortunately, these days, especially in our setting, we're seeing very young girls with breast cancer. We're seeing patients with in their 20s, 23, 25, 28. So fertility becomes such a major problem. We have fertility preservation options. And especially, so now this is in terms of the ovaries, because that's where the fertility is from. So breast cancer is about balancing the hormones, right? So most of our treatment is geared towards that, even after the primary treatment. So a lot of that affects the ovaries, the eggs, from producing what's needed for fertility to happen. But there are fertility preservation options like storing the eggs for IVF.
Oof.
There's also options of, now for the breast itself, there's reconstruction. So it doesn't have to be like I have removed my breast and it's like that. There are patients who go for reconstructive surgery, where after the breast has been removed, they get implants. And there are also many patients who also just operate like that. They just get like breast pads. Exactly.
Yeah.
And it's not it doesn't make you any different to have one less breast, because we tend to really be shy of that. It's a greater victory to know that I had cancer and I got my treatment and I'm okay right now, than to remain in fear of how will I live without one breast. Yeah.
Okay. So do we have any risk do we have any risk factors that we
Yes.
need to, maybe genetic, maybe
Okay.
how we live?
Yeah.
Yeah.
And that's across the board. So we have high risk factors and we have general risk factors. So risk factors is early girls who get their periods early, like those of us who got like when you're less than 12 years. If you start bearing children after 30 years, if you get into menopause later on, use of contraceptives, oral contraceptives, or any hormone replacement therapy, risk factors like smoking, alcohol use, obesity, physical inactivity, family history.
Those are so many.
Exactly. There's so many things. But the thing is that having the risk factors doesn't mean you will get breast cancer, right? It just means that you should be more aware of the need for you to be intentional about the screening. Like for myself, I know I started my periods before when I was 10 years old.
So now you need to do a lot of
exactly.
screening.
And I'm almost certain I don't have children. So I am aware of my risk factors. It does not
mean that
I will get breast cancer. Exactly. Because there are patients who don't have any of those risk factors and they still get breast cancer. So it's just about awareness. So that those high risk that we are especially keen about, like if you have family history if you have family history of cancer, if you've had maybe radiation, like mini imaging when you're younger because of maybe some other health issues. So those are some of the risks. And of course, women above the age of 40, we emphasize on the importance of screening through imaging the mammogram at least once a year or every 2 years. Yeah.
Now, I think we all have reasons to go for the screening.
Exactly.
Because the list was endless.
It was very long.
The list was like, I fall there. I fall there. So now you have a reason.
Yes.
Please, if you can. Let me ask. There's the simple home test that we are told to look for a lump.
Yeah.
Well, we can do it. Does that mean like it's purely screening at home? Because there's a test that you guys say, doctors advise us to lift and how does it go? And does it mean that once I do that test at home, I'm okay not to come for the screening?
Okay. That's very valid and very important. So for us at home, all of us across the board, and we said men and women, so we're still speaking to our men as well. So being able to be aware of your own body, and that's one of the most important things, right? Even before the doctor is able to pick a problem on your body, you should know this is my body and have ownership of it. And that's why the theme of this awareness is knowledge is power for me, because knowledge is me being aware of my body, so that in case anything happens, even before someone else points it to me, I'm like, this shouldn't be here, because I know what my normal is. And I love patients who come in and they're like, "Ay, daktari, this wasn't there before." You know, that awareness, as opposed to some, I didn't even notice that problem was there. So just being able to stand in front of the mirror, for the ladies, at least 3 to 7 days after your periods every month, or those who finish who are in menopause at the same time every month, being able to go in front of the mirror with your hands down or up and looking in the mirror and seeing, okay, how are my both breasts, comparing both of them, how is the right compared to the left? Does the one look like it's drooping? Is there something swelling, some swelling that wasn't there before? Does my nipple look like it's going inside? When I squeeze my nipple, do I see anything coming out? And then being able to feel, just using 3 fingers like this and going in a circle across the whole breast, over the nipple and in the armpits, and being able to see, am I feeling anything that wasn't there before? Now, the thing about this is, especially ladies who are younger, we have dense breasts, right? So you can feel your breast tissue and assume, there's something happening.
Like
and you get scared, but like 8 out of 10 lumps are not cancerous. So it doesn't mean that because you felt something that automatically it is cancer. So after doing that home check every month, at least once a year, going to a doctor and be like, okay, I've been doing this and I haven't felt a problem. Can you check me out? So that's the next step. So it's not just limited to, okay, I'm going to do it at home and I know for sure I'm okay. But getting that confirmation.
I love that. in that statement, you've demystified something else.
Yeah,
The lump.
exactly.
Most of us have the lumps, but not all of them
Yeah,
are cancerous.
exactly.
Because every time someone, there's how you can feel a ball that is moving around. So you get someone who's so scared.
Exactly.
You know, like, aki niko na cancer.
And it's the fear that's destroying us.
Exactly. But you've said even after doing it at home, you still need to go and see
Exactly.
a doctor.
For sure.
To confirm. I love that.
For sure.
I love that. Because guys, knowledge. Umesema theme ya this year is knowledge is power.
Knowledge is power.
And I love that.
Yeah.
Because hata hapa tunasemanga, just learn. It doesn't hurt hata kama utasaidia jirani.
Exactly.
You know? Because there are times you wake up with a pimple here. Kuna ile pimple inashika. Unasikia uchungu, unasema, oh my God. You know, we are all scared.
Yeah.
We are all scared. Isiku yaki niko na cancer ama nini. And then the way it's growing so fast, ni left neighbor cancer, you know.
Exactly.
It's spreading so fast. So, hata wewe unaona ni kama wewe you're falling in next.
Exactly.
Yeah. So after you've done it for several months, you still need to go and see a doctor.
Yeah, at least once a year you can do a checkup.
And you guys are doing the screening?
For sure.
For
you can
free?
Come.
Is it for free?
Yes. The screening for the breast exam is free.
This month?
So this month of October, yes. You can go to any government facility, private facility, depends on whatever screening cut cost they have put in place. So screening for women 40 years and above is going to be the breast exam, the clinical breast exam, plus a mammogram. Under the age of 40, we do ultrasound. From 20 to 35, we just do the clinical breast exam.
Okay.
Yeah.
At what age should maybe the girls and boys start the screening?
So we start screening. You can screen from your own examination, what we've said about your own awareness of your breast from the age of 20, and then the hospital clinic visits at least once every 2 years. But like image guided screening for mammograms is specifically 40 years and above. So for the younger ladies, 35 to 40, then we can do an ultrasound as well. But sisi wote kujijua mwili yetu inaanza from the beginning. So from at least 20 years, you should be able to be doing your own breast exam kwa nyumba. Yeah.
So if you're a mom with a daughter, mnaeza shikananga, it's a nice date.
Yeah.
Mommy dates daughter. Mnaenda mnafanya screening. So in case, now this is the other part that we fear. In case you've gone for the screening and now these are the results.
Yeah.
And turns out to be what you didn't expect. What are some of the treatments? Like, how do we start now the journey, the other journey? Yes.
All right. That's
I don't know why I'm scared to mention which journey.
It's okay.
But I hope you guys understand.
Yeah.
So now I've gone for the screening and I've been told you at stage 1, stage 2, stage 3. So how do we move?
Okay. So after we have confirmation that it is cancer, as we say, the importance of the staging is to guide us in terms of treatment options. So we have what we've discussed, chemotherapy. And for those who that's foreign to, it's basically just drugs that are either tablets or given through the veins, right? That's chemotherapy.
Oh, it can be tablets.
Yes, it can be tablets. We do have some chemotherapy that's tablets. And then we have what we call radiotherapy. So radiotherapy is like you're put in a machine, sort of that emits sort of like X-rays that's targeted at that area to reduce. There's surgery, which many of us fear, but for stage 1, stage 2, stage 3, it's really recommended to have surgery. And yes, then there's hormonal therapy. So a lot of patients with breast cancer, you'll find them being on treatment even after they finish the primary, because the hormonal therapy goes for a period of 5 to 10 years. So it's normally like a daily tablet. So yeah, so those are the treatment options for the basic treatment options for breast cancer.
So you're saying stage 1, 2, 3, normally it's easier. Okay, not easier, but they're advised to do the operation.
Exactly.
Because it has not spread.
Exactly.
So after operation, do we do the chemo?
So the chemo can be before or after the surgery, depending on the stage. So you find for the patients who are stage 1, they do the surgery. There's a report that we get after the surgery that helps us know if we need more treatment. But the chemo can be before or after. Yeah.
Okay. I'm assuming there's also counseling done.
For sure. Very important. This is not an easy job.
Yeah. I was just coming in for a date.
Exactly.
And then after, go have fun. Now I'm being told
you have this.
These are the options.
Yeah. And we
Okay.
don't even talk about one of the other things that's really overwhelms people is the cost of treatment, because that's one of the things I've also realized that makes people shy away from going to the hospital, because you're thinking, okay, so now if they find this, can I even afford all that? Yeah, where will I start? And someone is thinking, I'm a mother, I'm the one who's hustling for my kids. How will I be able to afford the treatment for this? So you just like, let me stay with my problems. After all, I don't know what it is.
Yeah,
you know,
what you don't know won't kill
exactly.
you.
Ignorance is bliss, we say. Yeah.
Yeah, because my next question was going to be even the community.
Yeah.
Now it has all this psychological effect. You see, I was okay. I was just
Yeah.
going for a screening. Of course, I had my own fears. They have been confirmed that what you were thinking is right.
Yeah.
So there's the family now that needs to come in and support us. So it's also overwhelming for the people around you, the caregivers.
Exactly.
Yeah.
And you're trying to be strong for your person, because you can imagine your daughter or your mother. I've had patients who brought their relatives, and most of the time we focus on the patients, which is true, but also how much it affects the relatives as well. Because you're here trying to be strong, like, I'm here for you. But you're thinking about all the things you've heard about cancer. What is this cancer? Where will the money come from? By the end of the day, we say that it's a long journey. That's no lie. It's a long journey, but we work it together. And one of the things that happens is sometimes patients get the fear of the treatment, and the option becomes, let me just go home. So we've discussed, I've told you that this is what it is. And because of that fear, you go home. You don't express that I don't have money for this, I'm not ready for this, or these are my concerns. And then you hear your neighbor telling you, baby, unajua ukipaka hii dawa itakusaidia. Ukipaka itakusaidia.
And now you're desperate.
Yeah, exactly. And people feed off desperation, and you start doing other things. So the emphasis is, the reason why the knowledge is power is because once you know what the right treatment is, you can't be easily swayed into other people who will try to take advantage of your desperation. Yeah.
And I'm happy because I've hosted, I think, 2 guests here who've survived cancer. Like even hearing their stories gives you faith, like gives you hope.
Exactly.
That, okay, this is not the end of it. As much as we have those bad stories, but I get what you're saying.
Yeah.
We are given the direction.
Yeah.
And I understand it's not easy at the same time.
For sure.
The doctor has told you this and this and this. But once you get home, your neighbor, you want to listen to that one.
Exactly.
More than the doctor.
Yeah.
So they're telling you, this one, usifanye, kama hiyo ya chemo. That is like your myth.
Is there.
Is imespread.
Yeah.
Usianze chemo, hiyo itakuharakisha, weka tu hivyo, you know. So now it's not even about the cancer alone, even the mental health.
Exactly.
Is not okay, because now,
sure.
Where am I?
Yeah.
So I would love you as a doctor. I know you've interacted with so many cancer patients. Zooming in to the breast cancer patients. Do you have like that one story? Like that one story? Because we love stories and we love hearing word of mouth. Oh, this one alifanya. They give us hope. So much hope. As much as sometimes tunakwanga hatuna hope kabisa.
Yeah, for sure.
Which you can just tell us, ya kutupatia tu hope. As the listener, assuming ameenda to screening this month.
Yeah.
Akapatia tuzo bad news. Like we don't know whether they are bad ama they are good ama go. You know, you never know. But ameenda screening na feel I am done. Madaktari wameni confuse. Majirani wameni confuse. Mi mwenyewe hata sijui niko wapi. Something to just give them hope.
Okay.
Yeah.
So, and it's very true. We get like a number of these patients in a day. Even earlier today, I was in the hospital. One of the patients I saw today was a patient who was diagnosed with breast cancer in 2016. And she did the surgery, she did the chemo. It was stage 2. She did the surgery, did the chemo, the radiotherapy, and she was on hormonal therapy for a number of years, had recurrence 2 years back, and got chemo again. And now she's okay. How many years from 2015 till now? So for sure, the thing I'll keep saying, it is a long journey. We're not invalidating the length of the treatment or just the constant need of follow-up and check-up, but we're doing this together. I may not be in your shoes, but just having that safe space to know that, just trusting the doctor, like, we're working in this together. Like whenever something else comes up, we're optimizing the best outcomes. That's what we're hoping for. We also want you to win, and we're winning together because your win is my win as well. And that's the encouragement that it is treatable. And even if there is recurrence, even if it's metastatic, our recommendations are based on how best can we give you the longest time possible with your family, and not just length, but comfort, because you can be living a long, painful time.
Yeah.
But there's hope in knowing that the options we're giving are options that are going to make you more comfortable. So you don't have to walk the journey alone, but we can do this together. Because if I'm aware of what your concerns are, then I'm in a position to address your fear so that we can tackle what we can. Yeah.
I love that you've mentioned having that safe space.
Yeah.
Because at such a time, you might need that safe space.
Exactly.
Yeah, you don't want the outside noise.
Yeah.
It might be too much.
Too loud, yeah.
Yeah, too loud.
Mm-hmm.
Thank you so much.
Yeah,
like, I feel it was, I don't know whether it was short, but it was straight to the point. Now that it is a week to 10 days to, personally, I haven't done screening for the last, I think, 2-3 years.
Mm-hmm.
Planning to have it done now that I've hosted you. I think I should have it before October ends.
Yeah.
But it doesn't mean that I can't have it in November.
You
or
can
December.
anytime, around
Just that
the
it won't
clock.
be free.
Yes.
Okay.
But you can still do the screening anywhere, as you said, because people, I'm assuming, are watching from all over. And one of the fears behind screening is I don't have insurance to be able to do this. But government facilities, you can do screening even for cervix, because for women, we tend to do both. So we do breast and cervix screening. It can be done concurrently. For a gentleman, again, breast through the examination, prostate, and colon cancer screening. So there are a number of cancers that can be screened around the clock. The point of this is to be able to know that we need to be informed about what's happening in our bodies. So just being intentional, like the way we prioritize other things, like making money, taking care of our family.
Our car.
Exactly.
Our kids.
Exactly.
Our house. That's family trip.
Yeah.
All this, but nothing about yourself. Nothing about your health, actually. Okay.
So that's the important message.
Yeah.
Just taking that step and be like, I'm intentional. I want to know what's happening in my body, regardless of the outcome. Whatever I find out, at least I am aware and I can do something about it. Yeah.
I love that you've mentioned all the other cancer. And also, it doesn't only limit us to cancer, health-wise.
Yeah.
Health-wise, nowadays we have people just falling.
Yeah, for sure.
Like, he just fell and that's it.
Mm-hmm.
He was very young. He was very active. He was okay.
For sure.
Yeah, all we need to do is just go for checkups, like regular checkups. I know it's not easy because you're scared, fear of the unknown.
Yeah.
But what if you just go in and you're okay?
For sure.
Do you know how happy that feels?
Exactly.
Like, I went in and I'm okay.
Yeah.
Next time I'll even have more reason to go in again. Because if something has happened between last time and now. So we are not far.
Exactly. That's the word.
Yeah, it's very recent.
It's very close.
So thank you so much. I think personally, I will try my best to go.
You will.
Yeah, that for sure. I'll try. This time, I'll try. Guys, please join me.
Yes,
let's go for screening. Fear of the unknown isituangushe na isitu stop. Please, if you can, just walk into any government. I know our government is failing us, but please just going into any facility. Give yourself a present for once. Acha tu nikajue kwa nini nasikianga hivi ama nasikianga hivi, Enda tu, alafu sa Christmas sasa utakuwa very happy, enjoying Christmas knowing that my health, I at least once this year prioritized my health, Thank you so much for coming. And guys, please, if you have time, they're you're on
Mbagathi way.
Yeah, maybe you can just invite them officially.
Yes.
Waseme tulisikia akiongea bata kutuambia tuende.
Yes, you're most welcome to Texas Cancer Center along Mbagathi way. We offer treatment services and also preventive services, including screening. Karibuni sana.
Na it is free, October. After hapo baadaye, take your mom, take your aunts, take your sisters. It's a nice date. Yeah, and that's it from me, guys. Until next week, same place, same time. Hoping it's going to be you on this seat. If you want to reach out, please, the email is here. Just call us or email us, then come share some knowledge with us. We love guests. We love guests. Okay, bye.